Or you can just delete that one.
Okay, so Leah, we're going to talk a little bit about these transitions from the antepartum unit to mother baby into NICU. And so if you'll tell us your full name and the units you've worked on and your role there and how long you've been with those.
I'm Leah Miles. I have been a labor and delivery and antepartum nurse for 15 years. And I just recently stepped into the role as the Women's Services clinical educator about a year ago.
Wonderful. Well, we're going to kind of stay with your bedside experience, but certainly pull in whatever you feel is appropriate regarding all the education that you're providing our nurses and staff. So as we look at these patients that are coming onto the antepartum unit, and then invariably, most cases have a baby go up to the NICU, but they pass through mom baby. If you think about those critical transitions, what are some of the things that sort of stand out for you about that experience for the families?
I think the thing that stands out most when they initially show up to the antepartum desk is they've just been given this news that no, they're not going to get to go home. And so helping them work through those emotions and figuring out what their most immediate physical and emotional needs are going to be. I think that's the most immediate, important thing that we can do for them. But then also, as they stay here for an extended period of time, those relationships that are built between the patient and the nurse become very, very important. So the next thing that stands out to me is, how are they going to transition from antepartum to a new set of nurses taking care of them who don't necessarily know their story like the antepartum nurses have. So helping the patient develop a rapport with her mother-baby team, and making sure the mother-baby team gets to know her and her story as well is super important.
Very much so. If you thought about kind of top concerns for our staff during those transitions, and that might be a little bit about what you've just touched upon, is the communication maybe between those nurses from floor to floor or unit to unit, in terms of equipping the new set of nurses about who this is and what, who this person is. Would you, or could you think of anything else that might be helpful as a mom goes from antepartum to mom baby, and then obviously the NICU team as well, and that's on a whole nother floor, and just acclimating after delivery?
Yeah, I think we've started to include, we have different cardexes, which are just quick sheets of paper that kind of give a rundown of a patient's history. So I think including the antepartum cardex and transferring that over to the mother-baby side, and even giving it to the NICU, might help those nurses who don't know the patient as well as the antepartum nurses kind of get an idea of what this patient has been through. Mm-hmm. I know that we've started to do that, and I think that that's probably really helping with the continuation of communication from teams of nurses.
Right.
So
right. How would you say, when you were doing your bedside nursing, did you care for both the patient and then try to tend to any partner or family needs? Because although your primary concern is this mom, she comes with usually a support person, maybe kids at home. How did you try to help, kind of meet the needs of the whole family system? And did you find it difficult, and kind of in what way was that challenging, if it was?
Yeah, it was certainly challenging, especially for some of those families who come, from far away, or they have other kids at home that need attention. And I think it is really easy for nurses to kind of forget about that significant other. So I think it's so important to include that significant other in the plan of care and communication. And I mean, it can be something as simple as, before you leave the room, you ask the patient if they need anything, but asking the significant other too, I think is just something really simple and easy that we can all be doing to make sure that these people are included.
Very good. If you could have any wish list, how do you feel like we could make the process maybe smoother? Be that for the families as a first answer, and then for our own staff.
Well, I know that we've recently acquired the Ronald McDonald House, which I think is huge and amazing, and it allows for these families to be together during these strange times, which we haven't had in the past. We haven't had really a gathering place where families can remain families. So I think that that's really, really awesome. As far as nurses,
yeah, if there was anything you feel like maybe the nurses might need, whether it is just a reminder about talking to everybody in the room. Of course you have to address most of the critical care questions are towards mom, but yeah, maybe something on that level of what else maybe could nurses benefit from in terms of their education, maybe.
I think I would have to think more on that.
Okay, yeah. If you though thought about, is there something you wished you'd known before you became a labor or antepartum mom? Maybe in particular antepartum. I mean, I know you floated between both, and you guys are trained for both those units, but if there was something like in hindsight now, and you're not at the bedside, but something that maybe somebody else taught you or shared with you about just quality care with these high-risk moms.
I think it's just keeping in mind and being cognizant of how much this visit and their time here can affect their life, whether that's at home with their children, how far away their home is, their work, what their financial status is, and if they're able to take time off. Or I think we get so busy and sometimes we forget to let ourselves think about all of those factors. And so I guess to maybe some of our newer nurses, I would just ask them to really think about and take into account how many factors this is affecting this patient's life.
Maybe try it on themselves. Can I imagine what it would be like to have to do this?
Just take a minute and put yourself in their shoes.
I guess we kind of talked a little bit, given you're not at the bedside currently, but just feeling like, did you have important information passed along, to you that would help you take care of patients? Now, of course, you were on the antepartum end, but would you ever have to take that patient over to mom baby when she was transitioning after delivery? Because I guess you'd go back to as a labor nurse and then kind of have to give a report to those mom baby nurses, and just recognizing anything that might improve communication there, other than the Cardex idea, which we've already implemented.
Yeah, we do a bedside shift report. So every time we transfer a patient to mother baby, we give them a little report from nurse to nurse in front of the patient and the significant other, so that they're aware of everything that's going on. And then most importantly, they can interject if there's something that's important in their care that they want the oncoming nurse to know. So I think that's a way to really loop everybody in onto the whole picture.
Right. Yeah. And then that nurse, after receiving your report, is going to be doing something similar to the NICU nurse, probably, to tell them a little bit about who this mom and this partner is related to the baby that's upstairs. How do you think we're doing, or what do you think maybe are our strong points in terms of these transitions and being mindful of what the families are going through?
Well, our social workers are amazing. I feel like we have such a wonderful team of social workers and nurses, and that helps the transition, from antepartum to mother baby to NICU. I don't feel like we could do it without you.
Thank you. What else would you add? Or if you did have like, oh, I sure wish we could do more of this, or, whether it is like a financial need in order to bring something on, whether it's a service line, or is there anything of that nature that you feel like, if you wanted to add as some bonus things for us to think about to make this a better transition?
I know a long time ago when I first started, we did like an antepartum mom's happy hour where every Tuesday and Thursday we'd get together at 3 to 4 o'clock, and they could just get together in a circle and just talk about and share. And I feel like for some of them it was really great therapy. Some of them didn't want to take participation in it, and that's okay. But I think that it was nice to have something like that offered to give these moms an outlet. I wish we could bring that back, I think.
That is actually on the horizon. And,
good.
And we are, as part of kind of the first part of the Vaughn, that's what came out of a lot of our interviews with families, was a gathering space. So administration is committed to that. So we're figuring that out as we speak.
Okay, good.
So that's exciting. But you had the same idea, and so we'll carry forward with that. So I want to thank you for your commitment to all these mommies and families and whatnot, and carry on, and we'll wrap up.
Okay.
Thanks.
Thank you.